Okay, well, the so-called public option would be out. The price tag would drop to $850 billion. That is the new health care proposal put forth by Senator Max Baucus just moments ago. But now there are questions about the core fundamentals of the reform movement. Is it constitutional for Congress to regulate health care? Judge Andrew Napolitano, our Fox News senior judicial analyst, is here with us now. And, Judge, that is the basic crux of the question is it constitutional for Congress, no matter what form they come out with, is it constitutional for them to regulate health care?
When I put that very question to Congressman James Clyburn, who's the number 3 ranking Democrat in the House of Representatives last week, he said to me, most of what we do down here isn't even mentioned in the Constitution, but we do it anyway. Unfortunately, that's the attitude of so many members of Congress. It is not constitutional. Health care is not mentioned in the Constitution. The Congress will claim that when you go to your doctor to have a pain looked at in your belly or to take medication for your blood pressure, that's commerce, that's a commercial transaction as a result, as opposed to the practice of medicine. So the Congress will say, just as the Commerce Clause was written, right, so that Congress would make sure that goods could get from New Jersey to New York without New York imposing a tariff on those goods, we can regulate health care. It just doesn't fly.
And so under that Commerce Clause, Judge, you're saying that really, in the grand scheme of things, that if I live in Connecticut, I should be able to buy insurance in California if I want to, right? If it's cheaper there, I should have the right to go buy it there in New Jersey or Maine or wherever.
You can buy anything you want in Connecticut from any other state except for health insurance. Yeah. It's the one thing that the Congress refuses to require the states to go over interstate lines. You can only buy health insurance as a Connecticut resident from a Connecticut health insurance company. If you wanted to tailor one to the needs of your family and buy a little bit from California and a little bit from Montana and a little bit from Minnesota, you couldn't do so. And that's the only product that the states can keep to themselves.
I want to clear this up, Judge, because it's very important, because now we've heard the president say many times that no federal dollars will be used to fund abortions under this bill. Now there's this amendment called the Lois Capps Amendment. She's a California congresswoman.
Right.
And there's some Democrats who are now saying, wait a minute, this does exactly that. This allocates, there's Capps right there, this allocates federal dollars for abortion. A lot of Capps and her side says, no, it doesn't. It does just the opposite. It makes sure it's outlawed.
If the Capps Amendment, which she has proposed, becomes part of the law, it will permit the federal government to spend millions more on abortions than it spends now. Right now, the federal government may only pay for abortions under Medicare or Medicaid. If the abortion, if the pregnancy was caused by rape or incest, right, or if the birth is likely to cause the death of the mother, under Congresswoman Capps' proposal, there would be 2 federal insurance policies, one with no abortion, one with abortion at any time for any reason.
I got to go, so it's very clear, Judge, no gray area. This thing would allocate federal dollars for abortion if passed.
Absolutely.
Judge Andrew Napolitano, Judge, thank you.